So, hello, my name is Jill Taylor, and I'm the director of the Wadsworth Centre, which is New York's public health lab. And I'd like to thank AdvaMedDX, the CDC, and APHL for the opportunity to meet and talk with you today. And I have to say I'm really, really proud that I was asked to represent public health labs in the country, and that makes me feel really good, so thank you. I'm going to talk from a slightly different perspective. I think it's important that you understand the network of what a public health lab network is and why we exist. Every state and most of the large cities have a public health lab, and with CDC, they form a protective infrastructure around the country that protects against public health threats. I like to think of it as a wheel. So CDC is at the center of the wheel, and then there's spokes going out, and then you have the rim of the wheel, and all the public health labs are at the rim, and then there are connectors going out from that to the commercial and to the hospital labs. And the fact that it's a network with information being bidirectional, going from in one direction and the other direction, is really important, and it's a real safety net for us. So when you look at a state public health lab and the CDC, our mission is much the same, but we serve different clients. So the CDC serves the nation as a whole, whereas a state public health lab or a local public health lab, a city lab, serves its community. And I think that that's very important to remember. So the state public health lab mission is very broad. We do surveillance for infectious diseases so that we know what's out there. We deal with outbreaks when they occur to limit their spread. We do newborn screening so that we screen every baby that's born in the state for, in New York's case, 47 different congenital conditions, and make sure that the babies get into care, the affected babies get into care very quickly, and we're using advanced technologies in that sphere as well. We also work in the environmental field, making sure that our water is safe to drink and that communities aren't affected by toxic chemicals. So very broad. One other area that we work in very closely with CDC is in the area of bioterrorism, so that we're continually on the watch for not only naturally occurring pathogens and toxins, but bioterror initiated attacks. And that's something that we 24/7, every day, we're always on the watch for, and it's important to either rule in and say, hey, there's a problem here, or rule it out so that people don't get scared. But it's mostly infectious diseases that I want to talk about today. So why is that so important? In the well-traveled world that we work in today, an infectious disease from another country is one plane ride away. I think we saw that with SARS in 2003, which began in Hong Kong. Well, it began in China, but then the big surge to the rest of the world was from Hong Kong. And the area that was closest to us was, of course, Canada, Toronto, which had an enormous outbreak. Very close. It happened again with Ebola in 2015. And we had a number of importations, which was pretty scary, really. And the reason that we were able to deal with these infectious diseases is because we're prepared. And I think that's the one point I really want to make to you today, that preparedness is so important. A disease importation can happen anywhere in the country, and we have to be in constant communication and constant watchfulness to make sure that we know what's in the area and how we can prevent them from spreading. So the Wadsworth Centre is one of the larger public health labs in the country, and with CDC, we've always been aware that science has to underlie preparedness, that building our technology and our policy on inferior science is just going to shoot ourselves in the foot. We have to be at the forefront of science. And science breeds technology. They go together. And just, it's so important. And we're in a really, I was talking to Kim about this, we're in a really interesting era at the moment, that some of the new advances in technology are really changing what our labs look like and how we work, and opening up huge possibilities for us. Let me give you an example. I'm a virologist by training, and when I entered the field, virology was, detection was based on growing a virus in cell culture, and then using antibodies to say, okay, it's measles, or it's a pox virus, or something like that. Takes several days to grow, and then you use a technique which is really not very sensitive, not very specific, and not all that accurate to say, oh, okay, it's measles. But by then, several days have elapsed. And you can, an infectious disease can move very quickly in a couple of days. Nowadays, as the speakers before me have said, we've got molecular assays where you can, things like real-time PCR, where you can detect a virus in under 4 hours, very accurately, very specifically. And companies like bioMérieux are working on real-time PCR, have marketed real-time PCR assays that you can actually use in a doctor's office, results in about an hour, very accurate, very specific. So you don't even have to have a lab. And these are amazing tools that, especially in underdeveloped countries, can be used in the field. And it's just mind-boggling and really, really very, very exciting. The most recent technology shift, though, that Dr. Kabaz mentioned is next-generation sequencing. And this has given us a tool whose power is just quite extraordinary. We can detect a virus or a pathogen. We can compare its sequence to other circulating strains that are in the area or in the world. We can say where the outbreak started, and we can tell what track it's taken to spread. And we can also tell, is it going to be resistant to drugs, or is it, or are we going to have to look for other therapeutics, or even use quarantine to contain it? And so it really informs our mitigation processes. And this is what the Advanced Molecular Detection Initiative has done for the lab network and our state lab infrastructure. Just to give you some examples from New York. In New York, we've been using next-generation sequencing in many areas of infectious disease, and our pilot project was in tuberculosis. New York is is fourth in the number of cases in the country with TB. Most of TB nowadays is imported from other countries, and the level of resistance is really quite worrying. So what we're doing is doing next-generation sequencing for every isolate that we have. TB is caused by a mycobacterium, and it's a very finicky grower. It's slow to grow on very complex media. And so getting to the point where you can say it's TB, it's this type, and it's resistant to these drugs, can take you several weeks to months. By sequencing tuberculosis, the organism, we can identify it, type it, and say it's resistant to drugs in about 10 days. Because at the moment, you still have to grow it in the short term to get enough organism to sequence. But this means that we can get the patient on the right drug straight away, which means that we can clear their infection and they don't transmit it to anybody else. So you also have to take into account that this isn't only good for the patient, it's good for the economy. CDC has done some work estimating that treating a person with TB, on average, if they're not drug resistant, costs about $18,000. If the TB organism is actually resistant to multiple drugs, it costs of the order of $494,000. Huge. So not only are we saving lives, we're saving money for the healthcare system. And so this just gives you an example of the sort of advantages that this technology gives to public health. So I find it very exciting, and so thank you for letting me come and talk today. I think we go on to see Oris now.